Welcome back, everyone. We will continue with the next session titled NCD Care and Equity, Air Quality, Coal-Affected Communities, Health and Equity. I would now like to request Dr. Venkat to chair this session.
Good morning and welcome back. So our next speaker for the session will be Dr. Prabir Chatterjee. So Dr. Prabir Chatterjee, after finishing his MBBS from Christian Medical College, Vellore, has been involved in training village-level health workers. He has also worked in the late 1980s in Tirupattur and Yelagiri tribal areas. So he has also been involved in training health workers in Purva Bardwan and Uttar Dinajpur of West Bengal over the years, and has worked for more than a decade in the Santal Parganas of Jharkhand. His primary focus area has been looking at early detection, prevention, and cure of tuberculosis, malaria, and Kala Azar. Dr. Prabir finished his master's in community medicine from CMC Vellore in the year 2000. He has later worked in the childhood immunization and maternal health areas, including as a polio surveillance officer in Godda district of Jharkhand for 4 years, and later on as a district immunization consultant for UNICEF in West Bengal. Uh, in SHRC Chhattisgarh, Dr. Prabir has been involved in training the Mithanins, the frontline workers, and also has been contributing to framing of policies for retention of rural medical assistance from 2014 onwards. Dr. Prabir has been involved in research on communities affected by coal in the Korba and Raigad districts. Dr. Prabir has joined the Amadar Hospital, Bankura in West Bengal in June 2020 as a physician and as a master trainer. And I'll now request Dr. Prabir to go ahead with this presentation.
Thank you, Venkat. The first question I'm going to ask the audience is, how many of you can tell me, any one or two people, what the PM 2.5 today is in, maybe in this hall or in Vellore or something? Does anybody have it on your mobile phone? Or the AQI, Air Quality Index? Somebody can Google, 35 is which, PM 2.5 or AQI? AQI. That's good because below 50 is supposed to be within normal. So it rained yesterday or overnight, so obviously it's a little pressure. Just keep that 35 in mind, though 35 was, you said it's the AQI. It's not exactly the PM 2.5, but PM 2.5 is very close to that. So let's suppose that PM 2.5 is 35 or 40 or something like that. Right. So we're talking about coal and the areas affected by coal, not about coal workers is what we usually talk about. And we're talking about the air quality, how that causes disease, and whether there are equity issues in this. So you can see the conveyor belt, you can see the coal, and you understand that the area is going to be very dusty. So as a sort of an introduction, this was a study we were invited to do. We were not funded, we managed to find funds, and we sent people up. There was an activist, there's somebody in the hall who knows Rinchit, and she said, there's this village where there's a new coal mine coming up, and can you help us? We'd like to show the people that there are going to be health problems. So they took 28 samples, and this was sort of training for us for another project. Some air samples, some water samples, some soil samples, fly ash, because there was some sort of electricity production and you get fly ash. So question 2, where does the electricity in this room come from? Where does Vellore electricity supply come from? Who supplies the electricity? Comes from a grid, but then it originates somewhere. Does electricity get cut in summer in Vellore ever nowadays? 20 years ago, it used to get cut in summer. And they say because it's not being supplied from Farakka, that is in West Bengal, quite far between Malda and Siliguri. So generally the electricity that we're being supplied in this hall to run our hospitals and all is coal-based electricity. Remember this when we're talking about it. So fly ash is a byproduct of that. They're burning the coal and then they're heating the water and you're getting a thermal power. So these samples and some sediment samples were collected from villages. These villages, Sarasmar, Korsampalli, Donga Mohua, these are the three I remember, but the other villages and the pasture lands around it. And it was published and it was given and it was supported by the Adivasi Dalit Mazdoor Sangathan of Tamnar, a group that was protesting the expansion of the mines there, government mines, Garipalma 4. And they wanted data to show why the mines were going to harm them and they were being displaced. And this was shown to the National Green Tribunal. And the National Green Tribunal actually accepted this report. And they accepted the report and they charged the Chhattisgarh government and said, you better do something about it. And then Rinchin came running back to us and Rinchin says, but how much, what will they spend the money on? Such an amount of money has been granted by the court, by this National Green Tribunal. Chhattisgarh government has to spend this amount of money. So what health priorities are you going to spend on? So again, we had to get involved out there. So this was the beginning. And these are some of the results. I'm not going to go into them in detail, but the PM 2.5 was high. There were toxic heavy metals, particularly when you burn coal, they're toxic heavy metals. And each of these things, so the aggregate levels of toxic particles are higher than the permissible standards. And in one thing, it was really high above the standards, and there was arsenic, manganese, and all. Now, the government fairly soon after that set up a national program of climate change and human health. So every state under NHM was asked to start a climate change and human health program. And nobody knew what to do. Fortunately, we'd done some of these studies. So we put together PowerPoints. And I know that Dr. Dades, who was here yesterday, had actually asked some activists here in Tamil Nadu, Sweta Narayan, saying, do you have any PowerPoint that we can show Delhi? A ready-made PowerPoint. So our Chhattisgarh PowerPoint was actually lent to Tamil Nadu. Anyhow, the program came up. So now it's a government program. This is not just activists. So air quality of Raipur and Korba has been tested almost every year under this program, originally funded by NGOs, and those NGOs are now being targeted by the government, saying they're anti-India and all that. And this is the report by the Chhattisgarh National Program on Climate Change and Human Health with Healthcare Without Harm, which is an NGO, and the State Health Resource Center, which really trains Mithanins, what you all call ASHAs in other states. So it's a government program with a sort of semi-quango, they call them, a quasi-NGO State Health Resource Center, and a little bit of an NGO. Healthcare Without Harm is an NGO. So we had two objectives. To start environmental monitoring of air pollution by the community. So that's why I'm asking you, do you know what the AQI in your area? Now it's very easy. You don't need these machines and all. You just look at your mobile and somebody else is monitoring air quality in Vellore and you can tell me what the AQI is. At that time, that was not possible. And that may not be what you're getting on your mobile phone, might not be good enough for policymakers. The second thing was to build capacities of these community health workers or volunteers so they can take it forward. What was the methodology? In these studies in Raipur and Korba, Korba has 9 power plants. One town, a highly forested area. Korba name probably comes from the Korwa community. Pahari Korwas are, I think, PBTGs in Chhattisgarh. But this district has at one point a town, the district town, which has 9 power plants and I think 11 chimneys out there. So obviously there's a huge chance of pollution out there. So air samples were taken from various places, residential houses and the roofs of public health centers by community health workers and CSO volunteers after being trained. And 14 samples were taken between November 20 and 21 in Raipur. And 12 were taken for Korba between 21 and May 20. So you say, but you didn't say that Raipur has got any power plants. And it's true, we don't. But there's an industrial area called Urla, very close to Raipur. And that has a lot of these sponge iron plants, which are unfortunately extremely polluting. And there's a horrible road there also. So there are various other sources of coal-based pollution. Factories and, of course, roads, both vehicle emissions and the thing. So we wanted to compare also. So all the samples were taken using a machine called a mini wall, taken continuously over a period of 24 hours. And this is a sort of standard that many international and national organizations will accept. So you take 24 hours of sample, that dust collects on some filter paper, then that filter paper is sent for an analysis. And we had to send it to the states. Now, what are the health implications of the results? I mean, this picture is very nice. I'm not going to explain the whole of the thing. You'll get a copy of the picture. And it shows that if there's manganese and lead, it affects something. If there's lead, which there was, and silicon, which there was, and PM 2.5, it can affect the eyes. You know it affects the lungs. You know it affects the respiratory system. If there's manganese, and there was in some of the samples manganese, it goes into the blood. The skin is affected. And there were a lot of skin problems, actually. They did some clinics after the Raigas study. And there were a lot of skin problems done. I kept saying fungal infection, fungal infection. It's a fact that if you have nickel in the samples, that might be the reason for the skin problems that look like fungal infections. There's also some studies there that show that maybe the fungal infections increase when there's certain pollution in the thing. GI tract, the whole of the body basically can be affected by the things. So I'll tell you a bit about the findings on PM 2.5 and silica. In Korba, the PM 2.5 was 2 to 28 times above the limits. What are the limits? The limits are 60 micrograms per meter cubed. We don't even have that today in Vellore. Now, you've been reading the Delhi reports. Anybody remember what Delhi went up to? It actually shot past 1,000 at one point, I think. There was one day with over 1,000. So they're huge things nowadays. So it's not that it doesn't happen in Delhi, but it happens for a few days and things like 27 today, PM 2.5. Think of it. You're within limits. You've got clean air. And Vellore's crowded city, lots of pollution around and all that. And nevertheless, it is 27. Much higher than European standards are 9 and things like, I mean, normal levels, they are 9 and 1 and 2 and all that. 10, I think, is their limit. Our limit is very high, 60. We're within the limit in Vellore. But 2 times that, to 30 times that. That's what was happening in Korba. And PM 2.0 levels in Raipur were 2 to 12 times in 22-23. They've repeated this study every year and they report it. It's part of the government program that we report this to the government. The government publishes the paper. We make sure that the government publishes the paper. We do the study maybe. We'll make sure that the community does the study, but the paper is published by the government. So levels of crystalline silica were elevated in all the samples of Raipur. All the samples of coal, including on top of our office. So both coal ash and construction sand have high levels of silica. So we're putting everybody in those areas at risk. Here are the values. Just look at that red. So this is, there's my office. I mean, where I used to work. 390.7. Can you see it there? Maybe I should bring an arrow there or something. 390.7 was on top of our office. Compare it with the 27 you're talking about. As bad as Delhi at the height. It's the middle of the town. It's a residential area. It's nowhere near that Udla and all that. Now, Bhatagaon and all that, that's bad. You can see Bhatagaon's 558 in the PM 2.5. Then you can see the whole bunch of high nickel levels. I haven't given the nickel limit out here, but you can see their high nickel levels. You can see that they're red in the lead. Whether lead should be 1 is 1.462. And all this stuff happening, Sadora Bazar, Acholi Birgaon, close to Udla. Now look at Korba. Korba, as I said, has got these 9 power plants. You expect it to be bad. There is actually coal mining also close by. And you see the level of 1,631 in Nayakasi Nagar this year. 1,631, not 999, not just over 1,000 as you're talking about in Delhi. 1,631. And in the residential areas, it was much lower, something like 186.5 in Manipur, but all violently dangerous levels of PM 2.5, manganese, look at it. Look at the nickel. Not that bad, but so the opening statement from the American lab that was doing it, it's called Chester Net Lab. This is the opening line he wrote in his report, and it's published in the government document we brought out. The pollutant levels are alarming. In my 20 years of interpreting data in Chester Lab Net reports, I have never seen a PM 2.5 above 1,000. In this set of samples, the PM 2.5 I told you was 1,600. Levels of lead in that Acholi, Birgaon, Sadora Bazaar were well above the Indian limits of 1 microgram, are particularly alarming. I might investigate whether there's an illegal or poorly operated lead acid battery recycling plant or other source. This is the 2023 report. It came out a month or two ago, released with government signatures on it. So that's what the nickel level should have been, 0.0015 or something, and those levels were above that. I've given the sources. Now, look at New York. At that time when I was making the presentation, the Delhi recent values hadn't come out. So New York, they did a report that came out in the MMRWR, the Morbidity and Mortality Weekly Report. And they really complaining. You know, in June, there had been forest fires, I think, on the Canada border. And they said, oh, it went to 122 in New York Metro. 1,229% above the 10-year baseline. And there you can see the baseline there. The baseline is 8 in New York. New York's not a clean city. So during June 1st to 14th, when these fires were going on in Canada and bits of United States just north of New York City, well outside New York City, a total of so many emergency visits were identified. 1,300, this was an 81% increase statewide. Now just compared it to that 1,600 levels, the 122 levels were killing people in New York. People were going to emergencies. So what are people in Korba doing? They're not running to the emergency, they're just probably dying in their beds. But this is the inequity between Vellore and New York and Delhi and an area from which we get our electricity. The whole of the country gets electricity. The whole of Chhattisgarh gets electricity. If we are getting electricity, are we throwing that burden on somebody else? Outsourcing to a tribal area? Our pollution. We are 27 because they are 1,600. So, exposure to increased concentrations of PM 2.5 over a few hours to weeks can trigger cardiovascular disease. This is something that, at least to me, was not very clear. I thought, oh, lung diseases, you know, when there's pollution. Cardiovascular disease, heart attacks, death. Longer term exposure can lead to increased cardiovascular mortality and decreases in life expectancy. I give you the thing. So, then why are we doing all these studies? To tell the government to do something. So we put, and we've been running these recommendations for some time. Nothing much is happening. They're published by the government and addressed at a different department of the government. So government has departments now. So we from the health department are pushing other departments to do something, and our own department. We felt in Raigar, that was not a government report, a study of pollution is needed, and you need to clean up the air, soil, and water. You need healthcare and treatment free of cost for all within 5 kilometers of a coal industry. And this was what was coming out in the NGT. They want to know what should we do and how do we spend the funds and all. Supply of safe water for drinking. Because the water was also, I've shown you mostly air samples and all that, but there were water samples taken, they were polluted. Soil samples were polluted too. So the food you're eating, the water you're drinking were also not safe. Not PM 2.5, but manganese, lead, nickel, all these things. And a continuous monitoring of emissions. And apprehend the polluters. Now we're getting into activist style comments. Apprehend the polluters and take action. Award the affected families damages from the responsible company. Who's going to pay? Why should the government pay? The company polluter, the company must pay. If it's a government company, yes, government company. But the polluter pays principle. And stop expansion of existing mines or setting up new coal mines. Now, this is the big fight. India keeps on, the COP is coming. The Conference of Parties is coming up, I think, early next month, beginning of December. Every year there's a Conference of Parties. This is the 27th or something. And they're going to discuss, and there's a whole bunch of things. And keeping on saying all over the world that you must stop. It was supposed to stop, I think, this year or last year or something like that. And India is going on saying, we can't stop, we're a poor country, we're not quite as polluter, and the average pollution may not be that bad. We don't have as much coal as, say, America or something like that. And we need to increase the coal mines, we need to make, they're taking the Hasdeo Arant forest. They're taking forest areas, those coal blocks they were giving out. They're giving it to Adani, they're giving it to somebody else. All this is connected. No? Recommendations, Raipur Korba, and these are tailored and therefore signed by government. Specialized healthcare infrastructure, I'm giving mainly the health ones, operated by the state under polluter pays. So we brought the polluter pays up and we said there should be special healthcare infrastructure. We're not saying much. We're saying that sort of speedometer that you can see outside. One of the teams has shown that little speedometer that can be connected to a mobile phone. We used a slightly bigger one, same company, a fairly standard company connected to a computer, but you can connect it to a mobile phone or a tablet or something. That sort of, maybe a spirometry in every government hospital, every district hospital in Chhattisgarh should have. You should have either inhalers or something. For somebody was saying that when you're treating asthma, Finney, I think, was saying down in the south, people use inhalers. Up in the north, people are using tablets. So we have to have in our essential list of medicines, inhalers. They're there. Make sure they're available down there. And they say, no, the inhalers should be available at the district hospital. For heaven's sake, all these thousands of patients with problems can't go to the district hospital. Your district hospital will be overloaded. You have to get the inhaler from the same place you get your hypertension medicines, from the same place that you get your diabetes medicines. The inhalers have to be permitted at primary level, at least resupply. Maybe the first prescription will be done by a doctor. So this was what we are saying about specialized healthcare infrastructure, then people to run the speedometer. You'll have a speedometer, you won't have to train staff. Health information to to improve prevention and mitigation. So the information has to be available on the TV news, on the newspaper, these big banner boards. So people know that this is a place which is polluting. State to conduct health studies and a committee involving the health department, pollution control, which are always nervous, and academic institutes, medical colleges, and the municipalities. We want committees where we can discuss. So, I'm throwing the questions back at you. What is this whole thing? Fairness between us in the medical college, in the town, in the academy, and people out there in a forested area, which is where we're going to mine coal, which is where we're going to put up a thermal power plant. So is this what we're talking about? When we're saying equity, we're just basically talking about a small thing called fairness. I know which slide is missing. I had a slide from Shiloh, I think I'll try to quote from it, to just show that let's see if I can pull it up. While I'll ask you the question, then I'll pull out the Shiloh thing. I knew that I had an updated presentation. I found that the Shiloh keynote speaker at the end was talking about the same things we're talking about. I thought that's good to address to people in CMC, there are no medical students, but at least they're PGs, that maybe we're talking about the same things in the long run. Are these recommendations we've just given? Don't forget that we had to tone down the recommendations because we're giving them out of government things. They just say, arrest the company, close the company down. You can't write that. You have to write as toned down as possible, as polite as possible. Next question. We are doctors, most of us. I mean, David Dugal's in the audience, and then there's our gentleman from Manipur work, and Then we've got that lady who spoke yesterday. But most of us here are doctors, not even nurses, not even physiotherapists. So what is the role of doctors? Is there a role for doctors in these questions of pollution, air quality? What is our role? One role, I think, is basic science. Certain people from among medical students and doctors will go into basic science, and you need to prove that the nickel in the blood will cause this. So if there's no basic science evidence, then we can't argue these things at policy level. There is a need for clinical research. You have to go and see those asthma patients and tell me, are the asthma patients not going to the hospital? Or among those who went to the hospital, are there problems? That is for the clinicians to talk about and connect it to what we're doing. Then I think there are two parts of this slide missing. Can you make the slide smaller? I think there are two other points. Basically there's community-based research, the type of research we do, training health workers, asking them to go to the field, make sure that the patients are getting the inhalers, they're not getting the inhalers, going and pressurizing the state and saying that you have to think. And then there's a question of advocacy. Should we sit on the committees? Should you, as a doctor, sit on a committee that's discussing pollution? That's the question. Some people will not go and sit on committees. They like to do basic research. They like to sit in a lab. Some people will say, we're doctors and we'll see patients. We'll tell you the results of our studies, which is important. Otherwise, how do I know that those cardiovascular diseases are due to pollution? Some of us are community people, and our interest is training the health workers, getting the community to respond and all that. But a certain number of doctors and health workers will have to sit on those committees. Otherwise, policies will not happen. I think that's all I'm saying. Questions?
Thank you, Dr. Prabir. The floor is open for comments or questions. Okay, while we wait, there's one question online from Dr. Anil Cherian. So were these reports shared with the people? If so, what was the response to this information and the vulnerability to ill health?
So in the Raigarh study, it was a study by an Adivasi pressure group, and it was immediately shared with them. And we had interaction sessions with political pressure groups and activists and civil liberties people for our first Raipur study, which is not mentioned here. These studies, the later Raipur and Kodwa studies, are usually shared at government level, but they are shared also with the Mithanins. And there are 70,000 health workers all over Chhattisgarh. And so the Mithanins have been involved in communicating. So this has been made into training. So we're not at the 7th module of ASHA training. We're at the, I think, 27th module. So there has been a module which has had a space for discussing what you do, what is pollution, and how do you prevent pollution, and how do you study pollution for the Mithanins. So it's transmitted back. That has always been State Health Resource Center's policy to try to transmit it back through all the 70,000 if they feel the policy is important. It doesn't matter whether we're talking about epilepsy or...
Second question from the floor. MNCs accused of pollution are running schools, microfinance systems, etc. Example would be Lanjigar. To sway the public opinion in their favor, what can be done about this? MNCs accused of causing polluting the environment are running schools, microfinance systems, etc., mainly to sway the public opinion in their favor. So what can we do about this?
This is a good question to the audience. You all please tell me. See, it's obvious. Very close to there, recently people have been hired, and I recommended somebody for working in that block, the northern block of, Ramani will be able to tell me, the northern block of Raigarh, just bordering thing. So I think APU has gone in there. But Jindal has a lot of work out there. Since Jindal is the main company that's polluting in that area, Jindal has community schools and colleges and this and that. And so a lot of our doctors will be working for Jindal. A lot of our doctors will be working for some other company. APU is not a polluting company, fortunately, and a little thing. So there's CSR, and we demand CSR. It's one of the fines, let us say, they think of it as a fine, put on them, that since you're doing something polluting, so you do some social work for the area. But the way the company tends to use it is that if I'm doing CSR, it should benefit me and the people in Tuamal, Rampur, or Kerpai and all should not protest so much against it. The company is always interested in that. Na? The Niyamagiri people will sponsor Bisam Kata. That's always done. So what do we do about it? I don't know. Can I tell people don't take money from the thing? Don't run your hospital. You're a doctor. You want to go and work in that area. Don't work for Jindal. At least you're going to that area and doing something. Na? This is a dilemma. If you all have answers, please tell me.
Okay. Are any of the local residents employed at these mines? What are the additional impacts?
Yeah. So if you are employed in the mines, then you will actually get more pollution. And so we met when I visited Korba. I was sitting waiting for our staff to come down. The man in the shop is good. Just a chakadai type of thing. And I said, you're quite breathless and all. So he said, actually, I worked in the mines. And I think he broke his leg or something. It was an occupational health problem. And therefore, I've never left the area. I run a chakadai in front of the mines. So definitely, because you could see he's breathless. I don't know whether he got it working in the mines or the thermal power plant, or he got it just by living there. It's a little difficult to differentiate between the community and the workers. But the chance of a worker getting thing is a little more definitely than the community as a whole.
Sure. So one last question. So any idea if the regulatory pollution control measures are implemented by these power plants?
Simple answer is no. They claim that they they claim that they're implementing them, but you have to keep watching. If nobody is watching them, there are no committees. If there are no people's groups going and checking. So this has been done in Tamil Nadu. Sweta had done all this work in Tamil Nadu before going there around Kadalur and all. So they'll go out whenever the gases are released in the middle of the night. They called it a bucket method. They run out with a bucket into the area that's smelling the most of sulfur, close the bucket, then take that air sample and send it for testing. And therefore, the community could say that though during the day they're saying there's no pollution and we're using the one of the regular tricks they use is they release all polluting gases at night. So the community has to keep watching. You can't believe the thing.
I think we have run out of time. Thank you very much, Dr. Prabir. Thank you.
Thank you, Dr. Prabir, for that talk. I request Dr. Venkat to present to him the memento.